Within which part of gastric gland are chief cell located? Fundus. Chief cell of stomach are most abundant in fundus. All of the following statement about Paneth cell are true except foamy appearance. So what is true about Paneth cell? Rich in rough endoplasmic reticulum, rich in zinc and contains lysozyme. Right gastroepiploic artery is a branch of gastroduodenal artery which is not supplied by pelvic splanchnic nerve appendix. So what is supplied by pelvic splanchnic nerve? Rectum, urinary bladder and uterus. Sphincter of Oddi consists of three sphincters. Vaginal sphincter is formed by all except internal urethral sphincter. It is formed by external urethral sphincter, pubovaginalis and bulbospongiosus. True about female pelvis is none of these options. The sensory supply of the fallopian tube and ovary is from D10 to D12. The dartos muscle is innervated by sympathetic nerve. Structure contained within rectus sheath are all except internal thoracic artery. So what are the contents of rectus sheath? Superior epigastric artery, inferior epigastric artery and rectus abdominis. The shortest part of colon is ascending colon. The right adrenal vein drains into inferior vena cava, to which lymph node the lymph from the umbilicus drain, axillary and inguinal. Valvula convenientis are seen in jejunum and ileum. True about ureter's entry into bladder at lateral angle of trigone, and it makes an angle and it is valveless. The following structures are felt on per rectal examination except ureter. So which structures are felt on per rectal examination? Bulb of penis, anorectal ring and urogenital diaphragm. True about prostatic urethra are all except trapezoid in cross section. So what is true about prostatic urethra? Presence of verumontanum, opening of prostatic duct and contains urethral crest. Vaginal sphincter is formed by all except internal urethral sphincter. It is formed by external urethral sphincter, pubovaginalis and bulbospongiosus. True about prostatic urethra are all except trapezoid in section. It is presence. What is true is presence of verumontanum, opening of prostatic duct and contains urethral crest. Celiac plexus is located anteromedial to lumbar sympathetic chain. Appendices epiploica is present in sigmoid colon, which is not supplied by pelvic splanchnic nerve appendix. So what is supplied by pelvic splanchnic nerve? Rectum, urinary bladder and uterus. Urogenital diaphragm is made up of the following except Cooley's fascia. It is made up of deep transverse perineal, perineal membrane and sphincter urethrae. Hypogastric sheath is a condensation of pelvic fascia. Lymphatic from the spongy urethra drain into the deep inguinal lymph node. Which of the position best describes the location of celiac plexus anterolateral to aorta? In postductal coarctation of aorta, collateral may be formed by all of the following except. So the collateral are formed by all of these: vertebral artery, suprascapular artery, subscapular artery and posterior intercostal artery. In portal hypertension, the site of portosystemic anastomosis include lower end of esophagus, around umbilicus and lower third of rectum and anal canal. The rectus sheath contains all of the following except genitofemoral nerve. So the rectus sheath contains pyramidalis muscle, inferior epigastric vessels and superior epigastric vessels. Pouch of Douglas is situated between uterus and rectum. Lymphatic of suprarenal gland drain into para-aortic lymph node. Which structures pass behind the inguinal ligament, psoas major and femoral vein. Flexor of lumbar spine is rectus abdominis and psoas major. Teres major of lever is a remnant of left umbilical vein. True about the anatomy of anal canal is puborectalis is essential to maintain continence. Internal sphincter remains in the state of tonic contraction. Ureter derives its blood supply from renal artery, gonadal vessels and common iliac artery and inferior vesical artery. True about right phrenic nerve, it is a motor branch and sensory branch. It arises from C4. It has a shorter course than left phrenic nerve. All of the following are derivatives of the septum transversum except ligamentum teres. So which are the derivatives of septum transversum? Falciform ligament, coronary ligament and mesentery of the lesser sac. All of the following organs develop in the mesentery of stomach except kidney. So which are the organs developing in the mesentery of stomach, liver, spleen and pancreas? All are sphincters of lower genitourinary tract of female except internal urethral sphincter. So which are the sphincters of lower genitourinary tract? Pubovaginalis, external urethral sphincter and bulbospongiosus. Upper limb weight is transmitted to axial skeleton by all except coracoacromial ligament. So the weight is transmitted by claviculo-clavicular, that is interclavicular ligament, costoclavicular ligament and acromioclavicular ligament. Sphincter of Oddi consists of three sphincters. Root of mesentery is crossed by a horizontal part of duodenum. Spleen projects into the following space of peritoneal cavity, greater sac. All of the following form posterior relation of head of pancreas except first part of duodenum. So which are the organs or relations from forming posterior relation of head of pancreas? Common bile duct, aorta and inferior vena cava. Urethral crest is situated in prostatic urethra. Which of the following is not a component of hypogastric sheath? Broad ligament. Which are the component of hypogastric sheath? Uterosacral ligament, transverse cervical ligament and lateral ligament of the bladder. In portal hypertension, lower end of the esophagus may show dilatation of vein. Which of the following vein drains into the portal vein from the lower end of esophagus? Left gastric. Arterial supply of the duodenum is by both superior mesenteric and celiac artery. Shortest part of colon is sigmoid colon. Length of female urethra is 4 cm. Which of the following structure is not present in the transpyloric plane? Inferior mesenteric vein. So which structures are present in transpyloric plane? First lumbar vertebrae, fundus of gallbladder and hilum of right kidney. Subdiaphragmatic right posterior intraperitoneal space is Morrison pouch. Posterior gastric artery is a branch of splenic artery. Which of the following is false about portal vein? It ascends behind the second part of duodenum is false. Portal vein is formed behind the neck of pancreas. Bile duct lies anterior and right to it. Gastroduodenal artery lies to the left and anterior to it. Duct of Bellini is seen in kidney. Scarpa's fascia is attached to facial aorta of thigh. Brunner's gland are seen in which of the following? Duodenum. From which of the following is the duodenum derived? Foregut and midgut. Where is the cave of Retzius present? In front of the bladder. Voldier's fascia lies behind the rectum. Spiral artery is a branch of arcuate artery. Superior pancreaticoduodenal artery is a branch of gastroduodenal artery. Bulbourethral gland open into which part of urethra? Spongy. Portal vein is formed behind the neck of pancreas. Resting pressure in the anal canal is because of internal sphincter. All of the following are supports of uterus except tubo-ovarian ligament. So what are the supports of uterus? Pelvic diaphragm, uterosacral ligament and round ligament. Weakest support of uterus is broad ligament. Corpora amylacea is seen in prostate. Dermatomal supply of the perineal skin is S4. Anterior relation of the right kidney are all except fourth part of duodenum. So which are the relation of right kidney? Liver, hepatic flexure and adrenal gland. Anterior end of the spleen is held up by phrenicocholic ligament. Obturator artery is a branch of internal iliac artery. Pancreas divisum indicates which of the following? Failure of fusion of dorsal and ventral pancreatic bud. Obstruction of inferior vena cava presents as thoracoepigastric dilatation. Accessory obturator artery is a branch of inferior epigastric artery. Right ovarian artery is a branch of abdominal aorta. Blastocyst makes contact with endometrium on 5th to 7 days. Minor duodenal papilla is opening of accessory pancreatic duct. Sperm maturation takes place in female genital tract. Structure immediately posterior to pancreatic head is right renal vein. If two bud of pancreas do not fuse, the anomaly is pancreatic division. Sperm chromosome faster is Y chromosome. Cystic artery is usually a branch of which of the following? Right hepatic artery. Most common congenital anomaly of the pancreas is pancreas divisum. Which of these is present midway between the anterior superior iliac spine and the pubic symphysis? Femoral artery. Which of these is false about celiac trunk? It lies to right of the chordate process is false. What is true about celiac trunk? It is the vertical branch of aorta. It has plexus around it. It has three terminal branches. False about portal vein. It arises behind pancreatic head. What is true about portal vein? First 5 centimeter does not give any branches. It has a constant length. It is a part of the hepatic portal system. Which of these best describes the renal angle? Angle between the 12th rib and the erector spiny. Relation of renal vein with the aorta is anterior below SMA. What best defines vasa vasorum? Small blood vessels supplying wall of large blood vessel are known as vasa vasorum. Spiral valve is seen in which cystic duct? Which of these is a branch of inferior mesenteric artery? Left colic artery. In patients with penile injury, Colles fascia prevent extravasation of urine and ischiorectal fossa. Portal vein is formed by the union of splenic and superior mesenteric vein. Sinusoid are seen in all of the following except kidney. So sinusoid are seen in liver, lymph node and spleen. Portal system found in liver. Somatic innervation to the pelvic organ is pudendal nerve. Tone of the anal sphincter is maintained by inferior rectal nerve.